Me kara kia tātou. Whakapua waiwha e whanake ana. Whakapua waiwha e tonui ana. Ke runga ake, ke runga noa atu. Me he akarata ka tiputahi ka pua waitahi. Kia tūkaha ina hihi o tamanui te rā. Ka mutu kia whai ora, kia whai hua, kia whai kaha. Homie, huie, tai kie. And the English version of that: flourish and thrive, onwards, upwards, rising higher, leading with strength and purpose. We are like the rata vines growing together and flourishing, to stand strong in the warmth of the sun. Hold on to what is good and grow these qualities. Live well, thrive abundantly, find strength, and united we are stronger. Well, welcome once again. My name is Claire Brotherton and I am the manager of the Data and Insights team here at Whaikaha, and it's my great pleasure to welcome you here today to our data seminar looking at new insights from the Household Disability Survey. Now, this is a webinar, so that means that the chat function and the camera and microphones are disabled except for the presenters, but you will have the opportunity to ask questions via the Q&A function, and I'll give you a little bit more information about that in a moment. Live captions are also enabled, so if you could please just go back one. Live captions are also enabled, so to turn them on, click on the CC button along the bottom of the screen. And we also have our NZSL interpreter who will remain spotlighted throughout. We do have some simple slides, so we will try to describe them as we go, but we'll also make all of the information on the slides available on our website afterwards. Next slide, please. So you can use the Q&A function to ask questions. So there should be a little box just along the bottom of your screen. Mine is over towards the right-hand side. And you can put your questions into the Q&A window, or if somebody's already asked a question that you would also like answered, you can upvote that question and then they will rise to the top. We will try and answer as many of those questions as we can, but we might not be able to answer everything. But we will keep a record of them, and then we'll provide some further information on our website, along with the recording of this webinar and a transcript. So I am now going to hand over to my colleagues from Stats NZ, Philippa O'Brien and Nicolette Edgar. I'll let them introduce themselves and take you through some of the data from the Disability Survey.
Thank you very much, Claire. I'm Philippa O'Brien. I'm a disability analyst at Statistics New Zealand, and I've worked at Stats on disability for about the last 10 years. So the disability survey that was run in 2023 was the first disability-specific survey that Stats New Zealand has published data from for 10 years. So the last one we did was in 2013. And the data set from the new survey is in the Statistics New Zealand Data Lab, or the IDI as we call it, and is available for researchers to use. And Stats New Zealand also intends to publish more data from the survey. So it was only initially published in February, so there's a lot more data that we can explore. Next slide, please. I want to talk today about why we have a disability survey, and tell you a little bit more about the one we did in 2023. Then we'll look more closely at how people were actually selected for the survey and how they were identified as disabled. This is actually quite an important thing to do before you look at the data, because you need to understand the particular population that we're talking about. So after that, Nicolette will discuss some of the findings from the survey. Next slide, please. Why do we have a disability survey? These regular disability surveys are run in most OECD countries, and there are four main reasons for doing that. They are to understand levels of functioning in the population, to inform, excuse me, the provision of services, for the equalisation of opportunities, and to support advocacy. Now, these 4 are not in any particular order, so this is not meant to indicate any priority. I want to go through each of these in turn. Next slide. Thanks. So the first one is to understand levels of functioning in the population. We do this in a survey by asking people how much difficulty they have doing a whole lot of everyday things. And using the answers to these questions, we can assign people to groups depending on their level of difficulty. So in our survey, there are only 2 different groups. And when we've assigned them to these groups, we can estimate the size of each group. So the group with functional difficulty, we call the disabled population, and the group that doesn't have difficulty, we call the non-disabled population. And the number of people in the disabled population is called disability prevalence. So we can also work out how many disabled people there are in smaller groups. For example, how many disabled children are there, or how many Māori disabled people. And it's useful while you're building that understanding of difficulty to also know what activities people had difficulty with. So understanding the size and characteristics of the disabled population allows us to plan for current and future needs across society. So this is a really important reason, and one of the reasons that has been very long-standing in disability surveys. Next slide, please. To inform the provision of services. So this is another important reason for collecting data in a disability survey. We can inform government policy and services that are specifically for disabled people, and it helps us to work out how much support they need, and most importantly, whether they're getting that support. It's very hard to find this information out any other way. Next. I just also lost my bits of paper. For the equalisation of opportunities, this third reason for doing a disability survey is to inform government policy and interventions that could give disabled people the same opportunities in life as non-disabled people. So we can find out whether disabled people are better or worse off than everyone else, and to understand why this gap is present. These 3 reasons that I've given you so far are the long-standing ones why governments have run disability surveys. But the 4th one, next slide please, is to inform, to support advocacy. So this is becoming an increasingly important use of data, in particular advocacy by civil society. So advocates can use data from the survey to raise awareness that New Zealand actually has obligations to address the rights of disabled people, and they can hold government to account. So under the UN Convention on the Rights of Persons with Disabilities, which the New Zealand government has signed, the convention actually allows for a group that is outside of government to monitor changes that are affecting the lives of disabled people. And this is increasingly what the data is used for. Next slide, please. So we will just look now at the survey itself, a little bit more at the survey itself. Along the top of this in red, we've got, in this particular slide, we've got the New Zealand Disability Survey, 1996 to 2013. And that survey was run in every year that we ran a census. So that was the first time we ran disability data from Stats New Zealand. We created disability data in 1996 using this particular survey. And at that time, it was the only source of disability data that Stats New Zealand, or really that was being produced from any government agency in New Zealand. In 2016, we started to publish data about disabled people from other surveys, from existing surveys, and there are 4 different ones shown here. So we began with the General Social Survey, and then the Household Labour Force Survey, the Household Economic Survey, and then we also added some questions to the population census in 2018. So there's 4 surveys there in black, and they're important sources of data, but they're not disability-specific surveys, so it's quite a different thing. The one that's missing from the list here is Take Penga, the Māori Social Survey, which is very important, but one of the reasons we don't actually collect disability information in that survey. We merge it with the population census, and we use that indicator to break the survey data down into the disabled and not disabled populations. So at the very bottom in red, we have the Household Disability Survey, which is the one that we've just released. So it's more like the ones at the top than it is like the others. It allows us to meet many of those 4 important needs that we've just looked at for running one of these surveys. And it's critical that we do run one, that we don't just rely on other existing surveys that can be broken down by the disabled and not disabled population. The ones in black in particular, just to reinforce it, they're really there for equalisation of opportunities. The questions that are in them are much shorter. The set of questions is much shorter. So we can't identify disabled people quite as well in those surveys as we would like to do. And the Household Disability Survey, the specific survey, allows us to use more questions and do a better job of that identification. Okay, next slide, thanks. So looking more closely at the 2023 survey, we selected a sample of 25,000 people from New Zealand residents living in households. And most people in New Zealand do live in a household, but people who don't are usually living in hotels, hospitals, rest homes, or prisons. So those are the people that wouldn't have the opportunity to be selected for this survey. And when the people were selected, they could have come from any age group, gender, ethnic group, or region. So that was all possible, but they just had to be in a household. And when they were selected, we did not know about their disability status. So both disabled and non-disabled people were in the survey. And one of the first things we had to do in the questionnaire was then work out which group to put them into. So we had to ask questions about functional difficulty to work out who was disabled in the population. I'll talk about that a little more in a minute, but I just want to go over the rest of the content. Other than working out who was disabled, what else did we ask in the survey? So next slide, thanks. The survey topics are shown here, and I will read them out. The demography topic is asking people about their age, gender, and ethnic group. There are some topics listed on the left, and they are employment, education, housing, transport, well-being, and leisure. And these topics basically allow us to ask about everyone's everyday life. So we ask everyone whether they had a paid job or went to school, whether their home was suitable for the people who lived in it, and the sort of leisure activities they might want to do. We collect information from everyone, but we actually have some extra questions for disabled people in these topics so that we can find out about barriers that they might have faced when they're doing things that they might want to do. And the questions on the right, were asked of only the disabled people. So early in the questionnaire, we've worked out whether the person is disabled or not, and then we've separated out the questions that go to those people. And in the 4 topics on the right are assistive equipment and technology, personal and household support, health services, and the child's main carer. And these modules had questions that were enabling us to find out what a disabled person might use or need in their daily lives, like what type of equipment or support they needed. So the disabled person facing this questionnaire did have a few more questions to answer than a non-disabled person, but this allows us to find out a little bit more about the challenges and what they need, and most importantly, what they're not getting that they might need that might help them in their daily lives. So, next slide, thanks. Just to emphasize this, when they were selected, we did not know if the person in the survey was disabled or not. And that's what I want to talk about now. So next slide, thanks. Who was counted as disabled? In this section, I just want to tell you a little bit more about how we worked that out, because it's really quite a debated issue, what constitutes the disabled population. And when we want to count people in a group, it's really important to be clear how we've drawn the boundaries around that group. Next slide, thanks. In the 2023 Household Disability Survey, a person was counted as disabled if they had long-term difficulty carrying out at least one basic function. So this is how the population in the survey is described, the disabled population, and it's referred to as a functional definition of disability. So I just want to give you more detail about the words that are in bold in that statement. Next slide, thanks. What is a difficulty? The person answering the questionnaire must say that they had a lot of difficulty or cannot do at least one of the activities that we ask about. So the amount of difficulty that a person has with an activity is for them to decide. We're not measuring their ability from the outside. It's a subjective measure of functional difficulty. And when is a difficulty long-term? It's long-term if it has lasted or is expected to last for 6 months or more. This is quite a common time period that we use when defining disabled people in a survey. It aims to exclude from the disabled population people who have a short-term difficulty like a broken ankle. So what are the actual areas that we ask about a difficulty in? And these are the ones for adults. There's 14 basic functions, and we call them functional domains. So I'm going to read them out. Seeing, hearing, walking, flexibility or dexterity, remembering, concentrating, learning, mental health, intellectual functioning, communication, personal care, socializing, pain, and fatigue. So there's quite a few domains of functioning where we're asking if people have difficulty. And inside those, each of those domains, we actually ask about 26 different routine activities. For example, there might be a question, or there is a question, in fact, how much difficulty do you have clearly seeing someone's face across a room? And there's another one, how much difficulty would you have walking 100 meters on level ground? So each of those functions listed there, those functional domains, we try to establish how much difficulty a person has doing activities within each of one. The 3 domains that are in blue at the end on that slide, socializing, pain, and fatigue, are specifically for adults. So for children, there's no questions in those 3 domains. The other 11 are used for both adults and children. And there's a minimum of 25 questions that a person would have to face even if they do not have difficulty in any of the functional domains. So just to get through that section of the questionnaire. And for children, we have 16. Has the slide moved on? I can't tell, sorry.
Yes, it has.
Thank you. So we have 16 functional domains for children, and inside those we ask about 19 different activities. Again, the ones in blue at the end are only for children, so they replace the 3 we saw in the last slide, and the other 11 are the same as for adults. So I'll just read out those 5 at the end. Accepting change to routine, making friends, controlling their own behaviour, developmental delay, and playing. Because children's ability changes as they develop, we use age-specific questions as well. So the questions will differ for under 2s, for 2 to 4-year-olds, and for 5 to 14-year-olds. And the other big difference for children is that the questionnaire is answered on their behalf by an adult. So the adult we're looking for is actually the primary caregiver for the child. And this is done regardless of whether the child is disabled. So just again, a reminder, this person is counted as disabled if they had long-term difficulty carrying out at least one basic function. So we've had a look now at what long-term difficulty means and what the functions are that we actually ask about in the survey. Out of the 21,636 people who took part in the survey, 3,757 people were found to be in the disabled population using this method that I've just described. So all the things that I've talked about are actually available in the publications on the STATS website. And so you can get some links to find them. But the key messages I just want to leave you with today are that the 2023 HDS provides new data about disabled people in New Zealand. There are other surveys that produce data about disabled people. But surveys define disabled people in different ways, and users need to be really aware of these differences when it comes to using the data from these different sources. So I think we're going to have a look at some of your questions so far, and after that, Nicolette will tell you some of the findings from the survey. Thank you very much.
Okay. Thank you, Philippa. So we have had a couple of questions in the chat. I will leave my video off so that people can concentrate on you. So one of the questions that's come through is asking how we account for the discrepancy between the previous data sets that showed 1 in 4 people as being disabled and this current survey showing 1 in 6.
Sure. So there's two big changes really between the New Zealand Disability Survey as it was in 2013 and the Household Disability Survey 2023. So the first one of those gave us the 1 in 4. And the second one is giving us the 1 in 6. So the 1 in 4 included a small survey that we ran in parallel with the Household Disability Survey. And those two surveys together made up the New Zealand Disability Survey. So that second smaller survey went to rest homes and care facilities. So there's a small proportion of the total population that ended up not in the survey because we chose not to run that survey. That made a difference of 1%. So your 1 in 4, the quote of 1 in 4, or 24% as it was, if you exclude that group, that would be 23%. So it isn't a huge difference, but it is one of the reasons that the total has dropped. Now, the second reason, and more important reason, that the total has dropped from 23% to, as you'll find out, 17%, is because of the bit that I showed you about the level of difficulty. So we have some questions that ask you, do you have difficulty in this particular area? The answer options to those questions are no difficulty, some difficulty, a lot of difficulty, and cannot do it all. And as I showed you before, you only are allocated to the disabled population if you had a lot of difficulty or you couldn't do it at all. So this means that people who said some difficulty or no difficulty are in the non-disabled population. Now, this differs from how we did it in 2013. In 2013, we didn't have 4 answer options. We only had 3 answer options. So you could say no difficulty, difficulty, or you couldn't do it. So in effect, a lot more people were ending up in the difficulty category because now we have only a lot of difficulty or cannot do it at all. So we've removed a group, if you like, that had some difficulty. So the very lower end of difficulty is now in the non-disabled population. This is following the guidance of the Washington group on disability statistics. This is a UN group which is doing a lot of work and has been doing a lot of work since 2001, trying to establish some standard ways in which people might measure disability in the international community, so across different statistical agencies. And this is one of their recommendations, is that the threshold, as we call it, is drawn at that point. I think that, is that enough, Claire?
Yeah, I think so. There's a couple of questions that touch on a similar theme, so I might try and combine that a little bit. So there's a couple of questions about the use of Washington Group questions to determine prevalence, and questions about whether the tool is designed for that. I wonder whether you could maybe touch a little bit on the difference between the Washington Group short set and this longer set, and why Stats have chosen to use this longer set for the prevalence measurement this time.
Sure. Yes, so we have used the Washington Group short set, and you will find it in some of those other surveys that I mentioned on the slide, with all the different surveys now since 2016 that we've added questions to. The Washington Group short set, for example, is in the Household Labour Force survey, and it's also in the census. The Washington Group short set only has 6 domains, or 6 questions covering. It covers seeing and hearing and walking, and then it's got 3 others which I believe are communication, remembering and concentrating is combined, and then personal care. So there's 6 domains, and as you can see from this discussion, the number of domains that we've got is much, much larger. So we've increased the domains, and we've done that to capture some of the areas or functional difficulties that people felt were being left out by the Washington Group short set. Some of those domains are promoted or advanced by the Washington Group for longer question sets for use in disability-specific surveys, but we've gone beyond that as well, because in our consultation we found there were particular groups that people wanted us to ask about, and intellectual difficulty would be one of them, that the Washington Group doesn't ask about, but we have asked about. So our question set is longer, and the disability-specific survey allows you to go for a longer question set, and it also has slightly different questions in some of the domains, which we've adapted to fit the New Zealand environment.
Thank you, Philippa. I'm keen for us to move on and talk about some of the results, but just one more question that's come up a couple of times is around people in residential care and whether they're included in the survey.
Residential care isn't included in this survey, and that's one of the main reasons we've changed the name to be quite specific that this is a household disability survey. So there is this chunk of the community that won't be surveyed, that won't be able to be selected. There are a number of difficulties with surveying that area in people living in residential care. There are challenges to going into residential care and running those surveys that are very different from the challenges for somebody in a household. So this was a decision that was made not to run that second small survey this time. So no, people in residential care are not included in this survey.
But it is true, Philippa, that people who were in, for example, shared homes were included and considered as households. Is that correct?
That's absolutely right, Claire. Thank you. Yes, we tried very hard and have made sure that we have captured in the group from which we can sample includes people who are living in homes which sometimes in the census they get put into a separate category of home. And so we made sure that was included, because that includes those sorts of groups that we used to call group homes years ago, but that name seems to have gone now. And they're really a lot of times it's disabled people living together, getting a lot of support from the community, but it's very like a household. Excuse me. So that, yes, they're definitely included in the sample.
Thank you. I think we might hand over to Nicolette. We will keep note of all of your questions, but we do want to make sure that we have time to move on to some of the results from the survey. Over to you, Nicolette.
Kia ora koutou, ko Nicolette Edgar toku ingoa. I'm really pleased to be here today to talk about data from the Household Disability Survey 2023. What you'll see coming up is a series of charts showing disability prevalence rates and stacked bars. A disability prevalence rate is the number of people who are disabled as a percentage of all the people in the population. On the charts, the disabled population is shown in grey and the non-disabled population in orange. So this first chart is about disability rates, and as you can see, 17% of people living in households in 2023 were counted as disabled in this survey. This was 851,000 people in New Zealand, or 1 in every 6 New Zealanders. The disabled rate for females was 18% and for males 15%. And it's interesting to see this difference with a higher disability rate for females. A gap between male and female has been reported in surveys overseas and is often anticipated due to the fact that women usually live longer than men and the connection between age and disability. We looked at the data and found that differences in disability rates remain after an adjustment is made for the different life expectancies of men and women. So that means that the higher disability rate that we see for females is influenced by their longer lifespan, but there's also other factors driving it. The next slide shows disability rates by age group. The pattern by age group is what we expected to see. The disability rate increases with increasing age. The child rate was 10%, followed by 12% for adults from 15 to 44 years of age. 17% for adults from 45 to 64 years of age, and 35% for adults aged 65 and over. When you look at the combined rate for adults, it's 18%. For adults, the most common difficulties were physical. 36% of disabled adults had difficulty with walking, and 32% had difficulty with flexibility or dexterity. People could report more than one functional difficulty, so some disabled people could report difficulty in both these areas. It's quite a different picture for children. For disabled children, the most common difficulties were not physical. 36% of disabled children had difficulty coping with change, and 36% had difficulty with their mental health. The next slide shows disability rates for adults and children by gender. The disability rate for women exceeds that for men, but what you can also show here is, interestingly, that amongst children, it's boys that have a higher disability rate than girls. So we see 8% for girls, 12% disability rates for boys, 20% for women, and 15% for men. In terms of ethnic groups, we've also looked at the disability rates, and we've got a subset of 4 bars here where you can see a disability rate of 21% for Māori, 18% for European, 16% for Pacific, and 9% for Asian. The relationship between ethnic groups was not surprising. Māori have shown a higher disability rate than other ethnic groups in previous surveys, and the rate for Asian people has usually been low. There are differences in the age structure of ethnic groups. For example, Māori, Pacific people, and Asian people are younger on average than people in the European ethnic group. We can adjust the disability rates to compare ethnic groups as if they had all the same age structure. And the next chart shows a picture of what it looks like when you do that. As you can see, after adjusting the rates of ethnic group to remove differences in their ages, the ethnic group disability rates look like this. So for Māori, it's gone from 21% to 24%. For Pacific, it's gone from 16% to 21%. For European, just a slight drop from 18% to 17%. And for Asian, it's still low at 13%, but clearly greater than before age adjustment. So it's gone from 9% to 13%. So that shows that the rates for Māori, Pacific and Asian people go up due to having a younger population group. Disability rates by LGBTIQ+ status. So the definition of the rainbow population group is based on the census. People in the rainbow population are younger on average than the total population by just under 10 years. So we see a rate of 29% on the chart there for LGBTIQ+ in terms of disability rate, compared to 17% for non-LGBTIQ+. But once we adjust for age, the disability rate for the rainbow population rises to 31%. The next slide shows disability rates for people with diagnosed ADHD and autism. So during the development of the survey, there was a lot of interest in the relationship between disability and neurodiversity. We asked people in the survey whether they had been diagnosed with ADHD or autism. Having one of these criteria is not one of these conditions is not a criteria for being counted as disabled. And this goes back to what Philippa was saying before about the level and long-term nature of functional difficulties. So out of people who reported that they'd been diagnosed with ADHD, 52% met the survey criteria for being disabled. Out of people that had been diagnosed with autism, 70% were counted as disabled. Now we'll turn to looking at some of the comparisons between disabled and non-disabled people in important aspects of life. This slide shows the next series of bar charts compares the experiences of disabled people and non-disabled people across a number of key areas of life. And in this first slide about overall life satisfaction, we can see a comparison of how disabled and non-disabled people scored their overall life satisfaction. The scale for life satisfaction runs from 0 to 10, where 0 is completely dissatisfied and 10 is completely satisfied. Disabled people are more likely than non-disabled people to have lower scores, with 32% of disabled people scoring less than 7, compared with 10% of non-disabled people. The survey also shows that disabled people were more likely than non-disabled people to say that they didn't have enough contact with family and friends, they felt lonely all of the time, or that it wouldn't be easy to find someone to talk to if they were down. And as many people will know in this audience, social contact is well known to be an important aspect of our well-being. This slide shows a comparison in relation to self-assessed overall health. Non-disabled people were more likely than disabled people to have very good or excellent health, the two highest categories. 68% of non-disabled people scored their own health at this level, compared to 30% of disabled people. And when we look at household income adequacy, we can also see when we're talking about the ability to meet basic needs of the household, that disabled people are more likely than non-disabled people to be living in a household that does not have enough or has only just enough household income to meet the basic needs of their household. And when we're talking about basic needs, we're talking about things like food, clothing, and housing. The housing quality for disabled people was lower as well. And in this next slide, we can see a comparison of the experience in relation to having a home that's damp, cold, or has mold. Disabled people are more likely than non-disabled people to live in a home that had at least one of these problems, so either too cold, damp, or had mold. 46% of disabled people lived in a house with at least one of these problems, compared with 36% of non-disabled people. And the chart shows that these differences exist regardless of the age of the disabled person. 9% of disabled people lived in a house that was in poor or very poor conditions, which was double the rate for non-disabled people, which was 4%. So that's a comparison of 9% compared with 4% for living in a house in poor or very poor conditions. And then when we look at employment, we can see that being disabled can affect a person's ability to get a paid job. An estimated 56% of disabled people aged 15 to 64 years of age were in a paid job when the survey was taken, compared with an estimated 82% of non-disabled people. That's a disability employment gap of 26 percentage points. For all adults, regardless of age, the difference was larger, with 40% of disabled people and 74% of non-disabled people in a paid job, which is a gap of 34 percentage points. This suggests that disabled people over 65 years of age leave paid work at a greater rate than non-disabled people do. Disabled people aged 15 to 65 who didn't have a paid job but wanted one were asked about the barriers they faced and what might help them to get into work. Common responses included things like more flexible work arrangements and a more positive attitude towards disabled people. More training and support, as well as help with job applications and transport, were also considered important, as was having appropriate equipment in the workplace. This slide shows the experience of disabled people around care and support and the degree to which there is unmet need. So it shows the estimated number of disabled people who had an unmet need for specific aspects of care and support. The survey estimated that 506,000 people in New Zealand, 62% of all disabled people, had unmet need for at least one of the aspects of care and support shown here. The top three in the chart, unmet need for support or accommodations in education or work settings, are actually quite high percentages of people who are in those settings. So half of disabled people at school and a third of disabled people in workplaces have unmet need for support or accommodations in those places. Providing reasonable accommodations is a key concept in the UN Disability Convention. Accommodations are changes to the environment that support disabled people to live their lives on an equitable basis with others. Examples include things like flexible working hours and locations, as well as things like equipment and accessibility. Another interesting inclusion in the 2023 survey was to gather information about how long adults have been affected by functional difficulty. Disabled adults who had lived with functional difficulty since childhood were more likely to have unmet needs than those who had become disabled later in life. So 72% of people disabled from childhood were estimated to have unmet needs. compared with 57% of people who were adults before they became disabled. That covers the data that we wanted to present today from the Household Disability Survey 2023. But as Philippa mentioned before, there's a wealth of data there, and you can go to our website to sort of see things in there around key facts, access the data tables, and find out more about what was there in the survey.